It's actually Jack.
Hello and welcome to Gateways to Healing. I'm Scott McGuffey, clinical hypnotherapist and your host. Gateways to Healing is a program where we look at how you can utilize complementary medicine with Western medical services. In this program, we introduce, explain, and explore the 4 gateways to healing: mind, body, spirit, and community. Today we're going to look at the gateway of the body. And with me today to help discuss those topics are our friends from Integrated Healing Arts. Let me introduce them now. On our right is Angie Weinberger. Angie is a certified massage therapist with a specialty in sports massage and deep tissue therapy. Angie, originally from Vienna, Austria, is the event coordinator and a member of Personal Best Performance Massage Team. She is also an athlete and dedicates her time and efforts helping others perform to the best of their ability. And next we have Lisa Riley. Lisa is also a certified massage therapist, a kinesiologist, and has 12 years experience in nutrition. She has a private practice at Blossom Birth Services in Palo Alto, where she specializes in pre- and postnatal massage. Lisa also adds to her experience by being a mother of 1. And then we have Jim Munch. Jim spent 30 years in the pharmaceutical industry developing prescription drugs. Having left that industry a few years ago, he now focuses on a more holistic approach to helping individuals access their deeper issues. Jim uses an integration of bodywork therapies which include massage, craniosacral, zero balancing, and acupressure. And also we have Emily Rosen. She is a practitioner of deep tissue massage therapy. Her orientation is aiding recovery from injuries and pain and meditative imagery for stress reduction and self-understanding. Emily has been practicing bodywork for over 10 years in Palo Alto. And it's a pleasure to have back with us Dr. Marianne Furta. She is a doctor of chiropractic. Marianne teaches anatomy, soft tissue techniques, and yoga at Palmer College of Chiropractic, De Anza College, the Body Therapy Center, and at Integrated Healing Arts. And also one of the things that Marianne asked me to say is that she's very good at integrating the body work with her chiropractic services, which I agree with. She also maintains an active practice in Palo Alto if that wasn't enough. So that's who our guests are today, and let's go ahead and just open the door to the gateway of the body. I think of the 4 gateways of healing: the mind, body, spirit, and community. People probably consider looking at the gateway of the body first because it's probably more familiar with them. I believe that most of us have had a massage or perhaps physical therapy after an injury, or maybe even chiropractic services. How do some of your clients utilize bodywork with the healing process? Angie?
I'd like to answer this question with an example of a client I've had before. He's a construction worker in his 30s, and he was referred to me by a doctor that I also work on. And he was in a car accident, so he went to the doctor to have everything checked out, if everything's okay, and then he was still complaining about neck pain and headaches. And those problems actually, he was working out on a regular basis. So I started working with him, and we did some lower back work, neck work, and after we worked together for a while, he's actually back to working out, and he feels much better.
Great. Emily, I wanted to also address this question to you. You do some interesting things in your practice where you use deep tissue massage, and you also do some meditation and guided imagery. How do your clients respond to that?
Well, this day-to-day stress and intensity that a lot of my clients experience in their lives is one thing that brings them in, I think. The imagery is just a helpful tool, and just to help a person to sort of access more of a better self-perception, perhaps, and the relaxation that goes with that. More kind, imagining their bodies to be their friends rather than their enemy, for example. That's one thing. But And so the deeper someone can relax, the more they're actually helping what I'm doing, which is the deep tissue work. So it's sort of a duet. We're working together. Yeah.
Great, wonderful. And Lisa, you do some specialty massage. You do pre and post natal massage. How do some of your clients go through this gateway of the body with the body work?
Well, Scott, a lot of them do come in for a physical complaint, usually first, and it's usually lower back pain. The developing fetus crowding the area around and pushing on bones and gets very uncomfortable. And so they'll come in for, I have one particular client in mind, she's about 29 and a half weeks along, and she had real bad low back pain, more so than the general average aches and discomforts. And so when I got to the low back area in the massage, just the mere touch of that, she recalled a memory of the birth of her first child, who she had excruciatingly bad pain in her back from back labor. And it brought up a lot of fears of why am I having this, and and it brought the fear itself was causing the tension and the pain in the lower back. So we worked with that a little bit of using the guided imagery that Emily was talking about, and trying to pinpoint the fear and to have her confront it and use some tools to help her relax, so that when that time comes, when she does go through the birth process again, that she won't tense up and have that pain
and bring some of those fears with her.
Right. And I felt that was a gateway to her exploring the awareness of it's not just low back pain, it's a fear or an emotion that comes up very often in
which could be causing the lower back pain, just not the physiological change in her body.
Yes.
Or compounding it even.
Right.
And that is, I think, one of the many benefits of the gateway of the body is that instead of just a normal massage, which feels wonderful and great, that there is also the opportunity for a healing process to open up and go into that. And for those of us who have had a massage, we all know that it feels good and it feels wonderful. And, I know that I'd probably like one every week, if not every day, if I could afford it. But I think we're touching on something a little bit deeper here. And Jim, you shared with me last week this wonderful definition of what you call universal life energy, which is sometimes brought up through the awareness of opening the gateway of the body. Would you like to share for us now that beautiful paragraph?
Sure. I found this paragraph when I was reading a book on Reiki, and it's called Reiki Energy Medicine, and it's a book that's written by some nurses, but it has this wonderful definition of, it says, universal life force, the fundamental principle of health. An invisible but palpable life form energy infuses and permeates all living forms. This energy is infinite, limitless, and pure. Intangible, it constantly bathes us. Inaudible and invisible, it fills us with peace. Odorless and tasteless, it sustains us. Although we swim in it, ingesting it with every breath, we are often unaware of its existence. Every living thing lives inside of and is inspirited by this force field. This life force energy is the essence that gives vitality to form. It is the primary activating energy of life and the underlying creative intelligence of the universe that organizes our world and everything in it. Ancient civilizations understood that this life force energy flowed through the body, supporting optimal development and fulfillment. The Chinese identified this energy as qi, the Indians called it prana, and the Japanese knew it as ki.
Yeah, that's wonderful. One of the things, the first time I heard that, when you shared that with me, was the idea that the gateway of the body is actually working with this subtle universal life energy. In what you do with craniosacral and zero balancing, how do you identify and perhaps guide your clients with the body work to express or become aware of that energy?
Actually, the energy is something that's very subtle. Sometimes they're aware of it, some people are not. But a person does not have to be aware of it in order for it to help them. And it's sometimes in the work that I do, I will actually facilitate the healing that the person is undergoing by channeling this energy to them in a particular way.
Well, that's a good point. In the other programs, we've talked about how all healing is self-healing. And it sounds like working more with this subtle energy that we're developing a little bit more of that. And Marianne, I just wanted to kind of segue over to you with this self-healing process and this universal energy. What are some of the things that you've come across with your clients where you've seen this this energy being facilitated towards the healing process?
Well, as Jim said, whether or not we're aware of it, it is an aspect of healing. And I think part of the work that we all do, since we are all aware of this energy, is part of the goal of helping to teach to increase an individual's awareness of themselves. And so part of that increasing awareness is an awareness of the energy. I remember talking with a patient who's also a patient of acupuncture. Has an acupuncture, so that's not my personal experience with this person, but talking about acupuncture and how with the particular placement of the needles, as there were more than one needle placed, and I am not real familiar with the acupuncture system, but I know that it has to do with meridians, and which are energy flows through the body, and the patient was recounting to me that she didn't have too much of an idea about whether or not acupuncture was efficacious when she first came in, but when that second needle went in, she could feel inside her body the connection between one point and another. And I think for those of us who do acupressure, it's very much the same kind of a system. So you have two contacts, and the person who is under the thumb or under the fingers can feel the connection. And as we're then able to help to increase their conscious awareness of of these energy patterns, then we can help to impede, help to relieve the impedance to the flow of the energy through the body.
Emily, I just wanted to talk a little bit with you about the subtlety of that energy in what you do with your massage work. How do you guide your client through this gateway for this healing? How do you work with them? How do you know where the energy is going? How do you direct it?
Oh boy, what a great question. Well, I have very seldom really talked about this process, or verbalized it, I should say, but I think everyone's different. But what I try to do is just find what it is that for them, well, they can see it as a metaphor and become that. That's one example of something that they can embody and really totally resonate with, so that will help them change any negative perception that's sort of, adding to a blockage within their energy field, and allow them to just see themselves in a more positive, expanded
So
light.
It seems like what you're saying, and what we're also picking up is that with the subtleness of the awareness, whether the client is aware or not, that there definitely has to be a role of communication between your gateway, your body, and what sort of things that you work with.
I work a lot with the actual inner communication. I mean, I think we all have our inner communication. That's sort of what I work with a lot with the imagery, is just to help someone with that sort of self-perception.
And it seems like the subtleness that we're now talking about with body work, I mean, oftentimes we have the view of body work as kind of being an extra perk to health and happiness, and however, it sounds as though the body work combined with this healing energy can do more, actually much more, when there's communication and there's the subtlety of the awareness of the energy, and you're all nodding your heads yes, so I'll take that as a good sign. Well, why do people come to get a massage? I mean, in your line, Angie, why do people come to you? What is their main focus? Are they just there to feel better for the moment, or is there something more within the communication and the intention?
I would say yes and no. I would say no, they're not just there to feel good for the moment in the work I do. My focus is on working with people over a period and really getting them to perform at their best, in my case with athletes, I don't think, oftentimes people come with injuries, and I work with them on getting back into where they were, and actually the goal is to get them at a better place, to have them perform better than they were before they had the injury. And if you look at professional athletes, a lot of them actually perform at their best after an injury. It's very common, actually.
Interesting. I didn't know that, actually. Yeah. And Lisa, you also do something that I just think is fascinating. I mean, the being a male, I mean, the birthing process, I can only imagine it because I could never be able to experience it. But how do people come to you? What are they looking for? And is it long-term with the work that you do?
Oftentimes they don't know themselves why they come in. They are referred, they have a gift certificate, or their mother says, you need a massage. Other people in their lives are noticing that they are under stress, they need to get some relaxation
Kind of that
somehow.
awareness thing Jim was saying, they're not even aware of it until somebody says, hey, you need to relax.
Something's out of kilter here, let's get you in to get some relaxation. So they come in expressing a need for relaxation. And so I get them on the table and talk to them a bit about, the communication is very important that Emily was talking about. And hers, I believe, was more intuitive. And that is very important. And the intent of the therapist is to be present and to listen to those subtle cues as well as the communication that's given. And to really find out what their true needs are and find out, is it more on a psychological basis or is it more on a physical basis that they need the help. And so one particular client I have in mind she came in very distraught, very under a lot of stress. She was trying to run a business while she was pregnant and just moved to the area and bought a house. I mean, it was just compounded. And so, she's got all the top 4 stressors right there, and she didn't quite know how to handle it, and she was trying to be very stoic and say, I can do this, and it's not a problem, but her body was telling her otherwise, and she was falling apart inside, and she really needed some guided help with trying to find a balance. And that's what I do. I also do kinesiology, and that works with the energy system as well, and I did a balancing on her to get her focused, to find out, pinpoint what areas needed to be worked on the most, and we worked that way with it to help her get a sense of balance and start prioritizing in her life what needs to be taken care of right now, which was herself. And to answer your question about do they keep coming back, most often I'll do a series of massages with them, and they often come out after the baby's born because that's when they need it too, their lack of sleep and
I imagine the body has to come back in shape, and
Yes, very important, and they really just can't believe that they went without after they get in this series, in this pattern. They think, what was I thinking of before? Why didn't I do this before? A lot of times.
One of the interesting things of speaking with you people today is that I think that we have perhaps a misconception of an image in our mind is that when someone goes to massage, that you always see the big guy karate chopping and the person on the table yelling and screaming. And as you were talking, Lisa, I just can't see that happening. Karate chopping on a pregnant woman. But there is this term, no pain, no gain. And I think that as far as the body goes and the gateway of the body is that a lot of people believe that it does have to be painful, and that release is stretching the muscle or alignment or what have you. Well, Marianne, what have you experienced with the pain aspect of your body work?
Okay, well, it really depends on the individual and where they're coming from. And I think Angie can attest to working with someone who's had an injury. If you're helping to rehabilitate someone after an injury, there is a certain amount of pain that they have experienced. If we're talking on the physical plane or even on the psycho-emotional plane of the emotional memory or the cellular memory of the injury. And there is a certain amount of, in terms of recovery, needing to open up areas of the body that have been closed. So with certain kinds of therapy, with myofascial release, for example, where you're helping to open up the body in ways that it's been closed sometimes for many, many years. So this is another instance of needing kind of ongoing care, because you can't, if you try to open up too much too quickly, you know, you either have an exacerbation of pain, or you can just sort of blow someone out, again, on a kind of a psycho-emotional level where they're just, you know, they're like become too loose too much. So, you know, so when you're doing fascial release, when you do trigger point therapy, the goal there is kind of to reproduce the pain, to move through the pain. But then there are all these other much more subtler types of therapies. In craniosacral work, the amount of pressure that's appropriate, depending upon what theorist you're practicing, is the weight of a nickel. Now, if you consider how much a nickel weighs, that's very subtle work. And that, of course, necessitates, again, that we all, as therapists, connect with our intuition and connect with the subtle energies of the body. And that's really where I think the most helpful work is. When I'm doing chiropractic manipulation, if I can, again, help to provoke enough, to help to create enough space inside the body and put the body in the position where it needs to be. Oftentimes I don't need to do the dynamic thrust. You put the body where it needs to go and take a breath, or encourage the client to breathe, and they can breathe and release and open up that articulation without, you know, elbows or crunches.
Jim, I see you nodding your head. You'd like to add something to that, I'm sure.
Yeah, and zero balancing, it's that's a fascinating modality, and that what we're doing is actually moving the energy, or helping the person move the energy within the body. We're not bringing outside energy in. So what we're looking for is bound energy, and when you find it, you can apply really not very much pressure, more like sort of like that, and which isn't really a whole lot. And this causes the energy to move, and what we're doing, we're sort of monitoring the patient to see what their breathing is, or the facial expressions, and they'll take these big breaths, you know, and you say, there it is. And it's really a totally silent thing. We're not talking to them at all, but we can just see how this is working, and when they're through, it's just, you know, they just feel so much better.
Great. I remember when I had my session with you on the zero balancing, it was certainly that experience where you just feel like your whole body taking a nice big breath, and you're feeling relaxed and actually focused. I felt very focused after that. I wanted to just bring up some of the ways that you people feel that your modalities, what you do, chiropractic, deep tissue, zero balancing, can work with Western medicine. What are some of the ways that perhaps to prevent injury, Angie, or maybe after the injury, what are some of the ways that your clients can use that modality?
Actually, I would like to, I experienced that actually working with the Western modality on myself. I had an injury, and I had surgery for the injury, and I was in a cast for a long time. And it was very helpful to be in the Western medical system. It was, you know, I got back into rehabilitation, and after that, you know, there was still some residue of work to be done that only massage therapy can do. So I found that's how I got into body work. That that body work was helping me getting back into shape, getting back into working out, being an athlete again. So that's where I see my place, kind of like an in-between, people coming out of injuries. Of course, you want to prevent injuries in the first place, but if there's an injury that has occurred, I think we kind of pick people up from where they come from the medical system and take care of them from that, and I think that's true for all of us.
Emily, did you have something you wanted to add?
Just that I would say I agree with what you're saying. It's that work that the medical community doesn't really have time or necessarily the background to address. And so much of pain is a muscular thing. A lot of what a body work does is a very physiological process too, that in Western medicine it's just not really their focus.
If I can jump in here and just
Sure.
suggest that, I think again it's on a gradation. Someone who gets regular body work so that the muscular system is balanced and the energetic system is balanced. Number one, in terms of being your own healer, the more we can help to increase a person's awareness of themselves, they're not likely to do something that's going to injure them. They're going to be aware of what their boundaries are, so they won't injure themselves. From another perspective, if their muscular system is held in balance, they're much less likely to need chiropractic care.
Ah.
If they get to a point where they need chiropractic care, if I can help them in that conservative way with chiropractic, then they're much less likely to get to a point where they injure the discs seriously enough to warrant surgery. So it's again all kind of a gradation of systems. So
And I
again,
think, and I think that's what we're finding with complementary medicine is that Western medicine is very useful because it takes up to the cure line, but with the full body holistic healing process is that we can go beyond that. I mean, we've seen various studies that have shown that people are in better health, mind, body, spirit, that when they are injured, that their injuries are less, they recover faster.
Right.
And that's what we're talking about with that, right?
Absolutely.
I
Yeah.
agree with Marianne. In my work, the Western medical doctors are very receptive and open to, they refer a lot of patients to me because they don't know why and they don't understand exactly what it does, but it's all they care is that their patient's not in preterm labor and they're relaxed and other problems are not going to arise, that complications with pregnancy that can happen. And it's very important to stay in that relaxed, balanced state, and you have an easier labor and you're a lot more just capable and ready for that process, which can be fearful. And again, the fear and the emotions bring in the tight muscles, and it's just a self-fulfilling prophecy, and they just have a more difficult time with it unless they're prepared for it more in terms of coming through and being prepared.
So the gateway of the book, go ahead, Jim.
Yeah,
We just have a
craniosacral-
few seconds, but go ahead.
Well, craniosacral has a really interesting application in optometry. For children particularly that have been diagnosed with needing major vision correction, if they go to a craniosacral therapist for adjustment prior to being fitted, they can have a dramatic change in their vision. There was one client that I was aware of that had gone, a child that was like 5 years old that had gone from 2400 vision to 2050 vision with a cranial adjustment.
Great, and I think that's where we're going to have to leave this on that wonderful positive note. And I want to thank all of you, Angie Weinberger, Lisa Riley, Jim Much, Emily Rosen, and Dr. Marianne Furta with joining us and sharing your words of wisdom and knowledge. And I'm Scott McGuffey, your host on Gateways to Healing, and I want to thank you for joining us and invite you to join us next time on Gateways to Healing, where we look at the gateway of the spirit. Until then, here's to your health. Great.